In Kenya, women were not being supported even in the hospital environment. They would go to hospital and then you start hearing of women, babies going into distress because the woman did not handle labor well. We have, after the baby was born, you would be brought your baby and you're told, breastfeed your baby. And then you're like, I actually have met women saying, okay, now I have this baby, how exactly do I do this?
What I find with the Kenyan health system is quite old-fashioned, and there's a system that we have to follow that's quite rigid.
Then there lies in the gap. Then there is no person who is there specifically for the mother.
The doctor or the midwife has 10, 15 other people that she's saying. So what happens is they'll come, they'll check, is everything okay? Then they walk away. They go to do they check on other patients. So what happens is a mom would be left alone, and she's, especially for new moms who've never done this before, she's left all alone. She doesn't know what is happening. I'm feeling all this pain. Is this normal?
With having Esther and a doula along the journey from beginning when you're pregnant to actually having the baby and after, because we still call Esther now and again when the children get sick and we're tired of giving them antibiotics. We try and find natural ways of healing our children. This is how doulas help us.
A doula is a professional who is trained in childbirth and who provides emotional, physical, and educational support to a mother who is expectant, a mother who is experiencing labor pains, and a mother who has delivered.
So 10 years ago, our rates were 23% in terms of exclusive breastfeeding. Now they're 60%. And that is because of people, I would say people like us, who are actually going and helping women along. Since I started doing this, I have actually helped around 1,500 babies.
The benefits of using the doula include that the mothers tend to have shorter labors. It's very nice for you to have a mother with a shorter labor because you want to reduce the time they're exposed to pain.
The Kenyan health system, the rigidness needs to change, and we need to encourage it more.
In the public sector, the need is greater because already the medical staff is overstretched. You have one nurse for 10 patients. So if each mom was well supported, so they labor properly, they labor more efficiently, we'll have better outcomes in the long run in terms of seeing better satisfaction, even for a woman. Most women say it was a horrible experience giving birth. And yet it doesn't have to be like that. And what makes that difference is the support that a woman has.